Hi, this is Neuron Loam, and today we are going to understand the difference between various terms that are associated with thyroid gland dysfunction. So, the very first term is hyperthyroidism. We all know that hyperthyroidism is elevated levels of T3 T4 hormone due to increased synthesis and increased secretion of thyroid gland. What we need to highlight here is that hyperthyroidism may show elevated levels of hormone, and that is strictly due to thyroid gland dysfunction only. Next term is thyrotoxicosis. We see in lot of books that thyrotoxicosis and hyperthyroidism, these two terms are used interchangeably. Okay, but there must be some difference, right? The difference is that thyrotoxicosis is a clinical syndrome caused by increased circulating levels of T3 T4. Okay, so in hyperthyroidism also there is T3 T4 k increased levels. In thyrotoxicosis maybe there is increased T3 T4 levels, but difference is in cause. Hyperthyroidism is strictly associated with thyroid gland ka dysfunction, but thyrotoxicosis can be caused due to thyroid gland dysfunction also, or there can be some other cause such as increased dose of dietary iodine or increased dosage of some drugs such as levothyroxine sodium or leothyroxine, which increases the level of iodine and it leads to increased T3 T4 levels. So this is not directly associated with thyroid gland ka dysfunction, but it is still increasing T3 T4 k levels. That's why it comes under thyrotoxicosis. So it is also said that hyperthyroidism is a specific type of thyrotoxicosis. Okay, the next term is Graves' disease. We all know that Graves' disease is associated with hyperthyroidism, but apart from that, it also includes enlargement of gland. That's some additional thing which is not seen in hyperthyroidism, thyrotoxicosis. Difference ka hai enlargement of gland. Apart from that, we have like three signs which is also called as clinical triad of Graves' disease. First is hyperthyroidism associated with enlargement of gland. Second is exophthalmos, that is protrusion of eyeballs. And third is infiltrative dermopathy, which is also like pretibial myxedema, जहाँ पे like there is orangish discoloration of skin over tibia, and it is seen with non-pitting edema. You can see that on Google. Okay, the next term is goiter. Goiter में there is again enlargement of gland due to impaired T3 T4 synthesis, but most often the cause is dietary iodine deficiency. Okay, we know this, but I want to also share like why there is enlargement of gland in goiter. मतलब goiter होगा, ठीक है, deficiency है iodine की, but enlargement क्यों हुआ है? So what happens is, okay, there is impaired T3 T4 synthesis due to either iodine deficiency, which is most common reason, or if there can be any other cause, जिसकी वजह से there will be decreased T3 T4 levels in blood, which gives signals to pituitary gland. Therefore pituitary gland will increase secretion of TSH. अब वो कंपनसेट करने के लिए दैट TSH का इंक्रीज सिक्रेशन कंपनसेट करने के लिए देर विल बी हाइपरप्लाजिया एंड हाइपरट्रॉफी ऑफ फॉलिकुलर सेल्स, और जिसकी वजह से देर विल बी एनलार्जमेंट ऑफ थायरॉयड ग्लैंड. सो देर विल बी इंक्रीज फंक्शनल मास ऑफ थायरॉयड ग्लैंड. अब इस इंक्रीज फंक्शनल मास है, ये ऐसा वैसा मास नहीं है, मतलब ऐसा वैसा मतलब ऐसा इनएक्टिव मास नहीं है, ये काम करता है वो जितना भी एनलार्ज हो गया है थायरॉयड ग्लैंड, इट इज़ फंक्शनल मास. सो वो क्या करेगा, इट विल डेफिनेटली इंक्रीज थायरॉयड हार्मोन सिंथेसिस. So either it will overcome deficiency, so it will undergo euthyroid metabolic state, that is normal level of thyroid hormones, or it can still leads to decreased hormone level. Although like despite there will be increased functional mass, still there will be decreased, if there will be like decreased T3 T4 levels due to inadequate compensation, it is called as goitrous hypothyroidism. Okay, well, the last term and very interesting term is thyroid storm. So what is thyroid storm? Thyroid storm is when thyroid gland suddenly, this is highlight word, suddenly releases massive amount of thyroid hormones. ओके, सडनली रिलीज हो गया मैसिव अमाउंट ऑफ थायरॉयड हार्मोन्स, उसकी वजह से वी कॉल इट थायरॉयड स्टॉर्म. वी नो लाइक वी कैन रिमेंबर इट लाइक स्टॉर्म तो अचानक ही आता है और बहुत बड़ा like it's big, so it is like massive amount and suddenly releases, so it causes severe hypermetabolism. और इसका सिम्टम क्या होता है? पेशेंट विल बी फेब्राइल and tachycardia out of proportion to fever. Now, what do you mean by tachycardia out of proportion to fever? So normally what happens is when there will be like increase in body temperature, for example, like this is normal ratio, uh, on per 1 degree Celsius increase in body temperature, there will be increase of heart rate by 8 to 12 beats per minute. But when these heart rates are increased more than this range, then that is called as tachycardia out of proportion to fever. So there will be like significant cardiac arrhythmia, and the cardiac arrhythmia can be very severe that patients literally die out of cardiac arrhythmia. So thyroid storm is actually a medical emergency. So that's about the today, and I hope I made these concepts clear. Thank you.